Now, around 10 million people around the world are thought to suffer from Parkinson's. It's one of the most common degeneration diseases globally. Here in the UAE, around 10,000 people are living with the disease. And in the past, many patients needed to travel abroad for treatment, but that's now changing, particularly thanks to an ongoing collaboration between Johns Hopkins and Clemenceau Medical Centre Hospital, Dubai. Joining us now in the studio is the Assistant Professor of Neurology at Johns Hopkins Medicine Visiting Physician Program at Clemenceau Medical Centre Hospital, Dubai. Very pleased to welcome Dr. Emil Mukhaiba. Doctor, thank you so much for joining us this evening.
Thank you so much for having me. I'm very excited.
It's great to have you here. I think Parkinson's is something that, can be often overshadowed. We hear so many stories about coronavirus, a lot of stories about monkeypox now dominating headlines as well. Do you think that, big issues like Parkinson's tend to get a little bit overshadowed?
Yes, I do, and I think we're up ahead against an upcoming epidemic of Parkinson's disease worldwide. About 13 million people projected by 2040 or so, and a very large number in the Middle East and North African area. The biggest problem is the lack of subspecialized care and even just general neurology and family practice care that can identify these diseases early on and treat them, and the subspecialized and tertiary quaternary type level care that can potentially provide complex care and advanced care that is not readily available in most places.
So tell me about some of the treatment options that are available these days. I know there's surgery that can help intervene. What tend to be the top recommendations? Obviously, every case is different, but what are some of the biggest technological advances we've seen that are changing people's lives?
Right, 100%. So obviously there's a lot of medications that always come about, but in terms of technological advances, we typically use a lot of deep brain stimulation, which is a device similar to like a pacemaker that we implant in the brain that helps a number of symptoms for people with Parkinson's disease, especially more advanced diseases. And there are some new technologies that are coming about quite frequently, like ultrasound-focused ablation therapy using ultrasound therapy instead of having to cut. But that's a completely different topic of discussion.
And what tends to be the success rate with something like that? Because I think typically when people had a Parkinson's diagnosis, obviously huge concern, not a lot of options. That is now changing. What is the success rate of some of the treatments you've just spoken about?
Right, so that's actually, in terms of deep brain stimulation, which by the way we also use for other diseases like tremors and dystonia, if you have the expectations set appropriately, knowing what it's supposed to treat, the success rate is almost 100%, bar the side effects that you have to keep in mind when having an intervention or surgery.
So a lot of new options available. Tell me about your visiting physicians program. You've got an ongoing collaboration with Johns Hopkins as well as Clemenceau. Tell me a little bit about how that works and why it's so important.
Right, so it's very important for the reason that there aren't enough subspecialized providers in the Middle East, let alone in the UAE, which we're hoping for it to be a travel hub for people to come and see us, to be able to treat these folks. So it's very important because you want these folks to be able to access subspecialized care, to be able to get the best quality of life as early as possible and as long as possible, and also provide these advanced therapies that general neurologists might or might not have access to, or the countries in which these people reside, including the UAE, don't have a lot of access to these type of therapies.
So tell me about some of the warning signs to look out for. Obviously, being able to visit you and this ongoing collaboration is an incredible opportunity. But for the everyday person, what are the sorts of things they should be looking for? I know age tends to be a big factor in Parkinson's, but what are some of the other things we need to be aware of?
Well, the first thing that I'm going to warn people about is there are three main symptoms that affect people with Parkinson's disease way before the actual movement symptoms come about, and that's REM sleep behavior disorder, basically kicking and punching in your sleep, acting out your dreams. The other one is long-standing constipation. And the last one is hyposmia, so loss or lack of smell. And these can precede the Parkinson's symptoms, the movement symptoms, by 20 plus years. So if you do have any of these, it's important to recognize and just keep that in mind. And obviously tremors, slowness of movements, difficulty with dexterity, changes in walking patterns and balance. The previous conception that Parkinson's disease that only causes tremor is also a little bit changed because some people might feel just rigid without a tremor. So if that is happening and you're slowed down, it's important to seek care through a doctor, obviously.
And what about preventative as well? Is there anything you can do to try and prevent the likelihood of Parkinson's? Does it tend to run in the family?
Right, so that is an excellent question. We are now starting to identify some environmental risk factors that can be potentially contributing to the onset of Parkinson's disease. We're not yet ahead of the game at this point. There is some genetic risk factors that do exist and run in families, and how the genes interact with the environment is something to keep into consideration, but nothing that we can pre-test for to be able to determine an actual diagnosis, an impending diagnosis. So yeah.
So no screenings yet available, but what would be your major piece of advice today to people who are watching the news this evening? What would your message be to them?
Hypervigilance about your symptoms and seeking medical care whenever something is coming up, because our clinical diagnosis remains the most accurate and most effective in identifying people early on, treating them early on, and giving them the best quality of life possible for as long as possible.
Excellent. Well, thank you. Some really important advice this evening. Really appreciate your time. And hopefully we can get those 10,000 numbers in the UAE a little bit lower with this kind of treatment.
Hopefully. Thank you so much for having us.
Thank you so much.
It's a pleasure.
Appreciate your time. Thank you.
Thank you.